Hi everyone! Have you ever wondered what is anesthesia? When you go to a hospital and someone tells you that you are going under anesthesia, what does that mean in this video? We're going to tell you all about it, so stay tuned. Anesthesia is the loss of sensation, most commonly of pain. It can also mean the loss of consciousness, like being asleep. Sometimes people use the term anesthesia and the term sedation interchangeably. Sedation means to make drowsy or sleepy, but it does not involve the same level of medical intervention as anesthesia. There are several different types of anesthesia. These include general anesthesia, local anesthesia, regional anesthesia, and sedation. The type of anesthesia used depends on the procedure being performed and the patient's needs. General anesthesia is the type of anesthesia that you may be familiar with. It's the type of anesthesia used for major surgery. With general anesthesia, patients are unconscious and do not feel any pain. They are usually given medications through their veins. This allows the anesthesiologist to control the depth of the anesthesia. General anesthesia can also be administered using inhaled medications. Some examples of general anesthetic medications include propofol, which is commonly used for short procedures, and medications like sevoflurane or desflurane, which are commonly used for longer procedures. Local anesthesia is used for minor procedures such as getting a shot in the arm or stitches. With local anesthesia, only the area where the needle will be inserted is numbed. The patient is awake during the procedure, but they do not feel any pain. One example of a local anesthetic medication is lidocaine. Sometimes your doctor may apply a cream containing lidocaine to the area where the needle will be inserted. Other times, the medication is injected right before the needle. Regional anesthesia is similar to local anesthesia, but it numbs a larger area of the body. There are several types of regional anesthesia, including spinal anesthesia and epidural anesthesia. With spinal anesthesia, the medication is injected into the cerebrospinal fluid in the lower back. This numbs the lower half of the body. Spinal anesthesia is sometimes used for childbirth. Epidural anesthesia is another type of regional anesthesia. With epidural anesthesia, the medication is injected into the epidural space in the lower back. This is the space just outside of the spinal column. Epidural anesthesia can be used for childbirth or other types of pain. One advantage of epidural anesthesia is that it can be adjusted during the procedure. If the pain is not completely controlled, more medication can be given. As mentioned earlier, sedation is different from anesthesia. With sedation, the patient is awake but is drowsy and relaxed. Sedation is sometimes referred to as twilight sleep. One example of a medication used for sedation is something called midazolam. Midazolam is commonly known by its brand name. First, you may have received this medication before a colonoscopy or other type of procedure. So which type of anesthesia will you receive if you need surgery? That depends on the surgery being performed. For minor procedures, you may receive local anesthesia. For major surgery, you will likely receive general anesthesia. Your anesthesiologist will discuss the risks and benefits of each type of anesthesia with you. They will also talk to you about what to expect during and after the procedure. What are the risks of anesthesia? As with any medical procedure, there are some risks involved. The most common risk is a reaction to the anesthesia medications. This can cause nausea, vomiting, or difficulty breathing. In some cases, the reaction can be more severe and lead to complications such as low blood pressure or even death. However, these reactions are rare when the medications are used by a qualified anesthesiologist. Another risk of anesthesia is that it can cause pain. This usually happens when the medication is being administered. Pain from the injection can be treated with additional medication. What can you do to prepare for anesthesia? If you are having surgery that requires general anesthesia, You will need to fast for a certain period of time before the surgery. This means that you cannot eat or drink anything during that time. The length of time you need to fast varies depending on the type of surgery and the hospital's protocol. In some cases, you may only need to fast for a few hours. In other cases, you may need to fast for up to 12 hours. You should also avoid alcohol before surgery. Alcohol can interact with the anesthesia medications and cause problems during surgery. In addition, if you have a history of alcohol abuse, this can increase the risk of complications from anesthesia. You should also stop taking certain medications before surgery. This includes aspirin, ibuprofen, and other non-steroidal anti-inflammatory drugs. These medications can increase the risk of bleeding. During surgery, you should also avoid taking blood thinners before surgery unless directed by your doctor. If you have any questions or concerns about anesthesia, talk to your doctor or anesthesiologist. They can help you understand the risks and benefits of the anesthesia and what to expect during and after the procedure. We hope this video has answered your questions about what is anesthesia. Stay tuned for more health-related videos. Thanks for watching.